Hi, Professor Stanley here, and today we are back to talk about hair, skin, and nails. Again, this is part 2. So let's start with the hair. When we are examining somebody's hair, we're going to inspect it and look at the color, the texture, the distribution, and lesions, and especially pay any attention to any bald spots, what the pattern of baldness is, and whether or not it's a natural baldness or something that's related to an underlying cause. Of course, the hair should be clean, free of lesions and pests. Some dandruff is normal, and that would be like a flaking of, the skin that occurs from dry scalp. Some of that is normal, but we shouldn't see it widely distributed. Also, one of the main things that we're going to be called upon to do as we're working with children is to sometimes identify lice. And lice, of course, is a parasite that can live within the hair. And in order to identify it, we're going to separate the hair into sections and look for small insects that are about the size of a sesame seed or less in size, and they're usually brownish in color. We're also going to look for the presence of nits, which are going to resemble small whitish colored specks that are cemented onto the hair, and they do not remove easily. You're going to have adequate lighting in order to do this type of inspection. So I highly suggest that you make sure that you have like a bright, more direct light when you're looking for these things. And they can be harder to spot on light colored hair. But as you look for it, if you do see, sometimes you will see the eggs, but you will not see the actual live insects. But they do tend to actually hatch out every several days. And even though there are not live insects at this time, that does not mean that there won't be in a day or two. So now let's talk a little bit about the nails. Nails should be inspected for their shape and their contour. They should be slightly curved or flat, and the nail edges should be smooth, rounded, and clean. When we have nails that aren't clean or have things under them, that is a sign of someone's personal hygiene or an ability to participate in activities of daily living. I do want you to take a look at your book about the information that is on nail angles, because as the nail angle changes, this can be a sign of something that is an underlying disease process, such as clubbing, which occurs in congenital cyanotic heart disease, lung cancer, and pulmonary disease. And so the nail can be a sign of an underlying disease process, so we want to pay attention and understand what that might look like. We're going to look at the nail for consistency. The surface of the nail should be smooth and regular and not brittle or splitting. The thickness of the nail should be uniform, and it should firmly adhere to the nail bed. If it does not firmly adhere to the nail bed, fungi can get underneath the nail bed and cause an infection to develop, and this will cause the nail to yellow and thicken and be very brittle and flaky, and you can usually tell when there is a fungal infection in the nail. The color should be translucent, and the plate should reveal the translucency, and it should be even and should have a pink nail bed. Sometimes in darker skinned individuals you will have linear bands of streaking along the nail edge, and this is not going to be an abnormal finding. There are some pictures of that in your book that you can take a look at. We will also test capillary refill in the nail bed, and that means that we're going to press on the nail for about 5 seconds and then release it, and you should see a very quick return to the normal color. So when you press on it, it will blanch and become whitish, and when you release it, it should become red again very quickly. A sluggish return of color can indicate cardiac or respiratory dysfunction or septic shock and is a sinister sign to be watching for. Another thing that you will notice as you're inspecting the nails is sometimes the nail can actually embed into the surrounding tissue and create what we would call an ingrown nail, and that will cause it to become red and maybe infected, and you might see areas of abscess that might form underneath there with pus. So we want to pay attention to our nails because there are a lot of things that can go on with the nail that would be things we want to address. So once again, there are some great pictures in your book of all kinds of abnormal findings that you might see. So I would encourage you to spend some time looking through there and kind of familiarizing yourself with what some of those abnormal findings may be. Thank you for taking the time to listen. This concludes our hair, skin, and nails content.